Erectile dysfunction, or ED, is the inability of the patient to get or maintain an erection satisfactory for intercourse. The patient who's complaining of erectile dysfunction doesn't necessarily have to be sexually active with a partner. Sometimes people will tell you, for example, that they've noticed change in the frequency of their erections in the morning, a change in the erections that they get if they're self-stimulating. Patients will report a wide spectrum of symptoms in terms of the extent to which they have this problem. Generally speaking, what we're talking about, if erectile dysfunction is a short-lived problem in a patient, was probably what we call psychogenic erectile dysfunction. Some sort of emotional stressor, life circumstance, something triggers this problem for the patient. Along the same lines, we have to take the severity of the patient's symptoms and put them in the context of their overall health. And the patient who tells me, "Doctor, I've had erection problems for years and years, but I also have diabetes, heart disease, high blood pressure. I take the following treatments for that." Those are things that help us to understand what the severity of the problem may be. In terms of risk factors for erectile dysfunction, things like peripheral vascular disease, coronary artery disease, high blood pressure, diabetes certainly. So very good studies that have been done over the years tell us that, for example, the man in middle age who reports erectile dysfunction as a new complaint is more likely in the subsequent years to have, say, a heart attack or a stroke than the next patient of the same age with the same medical issues who doesn't have ED. I'm always encouraging young people who smoke to quit smoking in an effort to avoid developing this problem later on in life. Other important lifestyle risk factors, certainly poor exercise habits, poor diet, excess alcohol consumption. These are all things that can contribute to an increased risk of ED. ED is a devastating problem for people in terms of the impact it has on the rest of their life. Relationships, all kinds of things that suddenly change because someone's dealing with this problem and usually starts asking themselves questions like, if I can't fix this, what does that mean for the rest of my life? These are really weighty questions. For the patients who come in and see me, I recognize that if he has this problem, I probably do need to involve other physicians like a primary care doctor or maybe even a cardiologist, depending upon the patient's family history, his risk factors, in an effort to try and keep him healthy otherwise.